In tonight's cover story, the health of medicine.
Medical reporter Dana Baer looks at a system coming out of pandemic but still experiencing sickness.
Those who care for sick patients know the system is in crisis. But if medicine is sick, how will healthcare workers take care of themselves so that patients can get better? Over the next several weeks, we talk with doctors, nurses, and administrators about medicine. People are leaving the profession. Wait times to get help are astronomical, while face-to-face time with a healthcare provider is minimal. Examining medicine under a microscope, the only diagnosis is sick. But caregivers say, even as they feel as if they're drowning, they're committed to finding a way to stay afloat.
My name is Marie Cheslick. I am a registered nurse, and I'm also a sommelier and a small business owner. I have started my own wine business. I do wine consultation under Slick Wines, and we do wine tastings, which has been so much fun.
How different is that?
Surprisingly, it's kind of similar to what I was doing before, in that it's all the things I liked about nursing. I get to talk with people and I get to educate.
And I kind of wanted just to start with one of my favorite natural wines right now.
I just talk more about wine than diabetes medication.
So if you have a clear wine, it's not necessarily because it was fined. Faults are pretty much just bacteria in wine that's not really supposed to grow in there. Of course, just like a gut biome or a human biome.
So when people ask you, when you're doing one of these wine tastings, why are you here if you have a nursing degree? What do you tell them?
I don't get that question very often, which is, I think, also affirming to why I do what I do. I think that even before the pandemic, there's lots of people who wouldn't sign up to be a nurse. They're like, I don't want to do that. Like, yeah, maybe it's a good job, but I'm not doing it, right? But now more than ever, people go, oh, you were a nurse, now you're this? Okay, that makes sense.
My name is Michelle Berg, and I'm a clinical informatics specialist.
If I had asked you this a month ago, what would you have said? What's your name and what's your job?
My name is Michelle Berg, and I'm a NICU nurse.
What was the most rewarding part of your job?
The day-to-day, just being able to teach a new mom how to do basic things and seeing the outcomes of their success. These were a set of twins I took care of in the NICU over 20 years ago, and they're probably in college now.
And they came back to see
And they came back to see me when they were 16.
So why the change?
I was kind of burnt out. I was just doing the same thing over and over and over, and I really wasn't growing. I needed to do something different. For me, that might have been one of the other factors that really drove me out of bedside, was that 12-hour shift. You know, getting up at 5, leaving at 6, getting home at 8:30. 3 days a week. That doesn't always work. Currently, we are seeing a brain drain in the hospitals, really at the bedside.
I worry about keeping people alive. Like, yes, of course, keeping people safe, but at bare minimum, I should have to worry about, am I a good enough nurse today, or am I staffed enough today to keep people alive?
When you said full patient load, what was full patient load in 2015 compared to full patient load in 2022?
It was 4 patients to 1 nurse during the day shift, and the night shift was either 4 or 5 to 1.
And what is it now?
I was pulling 7, 8 on the day shift per nurse. Depending on the orders, or if I'm just busy with another patient, whether it's I'm at a procedure with them or something worse, like if I'm doing a code on someone, Sometimes that takes an hour or two, and it just leaves my potentially 6 other patients high and dry. It's a labor-intensive job. It can be very hard, but I feel like I don't have any days where I can catch my breath, and I don't have any days where I can get every patient what they need, especially when it comes to pain management. It seems like such a simple thing, but it's increasingly harder to do the simple things for patients these days.
And how much does it pain you to think that they're sitting there in pain waiting for you to come to their room?
It's hard, but I also can't think about it too much because it puts my other patients at either at risk or in the same situation. I just have to shelf it in my head somewhere until the shift is over.
But obviously, it didn't just end the shift.
No.
It ended your nursing career, at least for now.
At least for now. There's only so much a person can take, and I needed to take care of myself at the end of the day too, as much as I take care of my patients.
It's not all about money. It's about well-being. It's about not having heart palpitations when, you're in the middle of a situation at the hospital that requires you to think very calmly. Those adrenaline rushes over time can really wear you down.
So do you feel like you're not escaping, but you're moving in order to ultimately make things better?
I never left the bedside because I didn't like the bedside. I left the bedside just to become a different type of patient advocate. I became an advocate for safety, really.
So it sounds like you have hope for the future.
I do. I have hope. I still think that there's a lot of bright people going to nursing and medicine. I would never inhibit anyone to go into it, but I would just say tread with caution and understand what you're going to be doing for the next 5, 10, 20 years, however long you decide to stay in it, because it's a long road.
What's the answer?
Just giving nurses the resources they need and making sure we have safe nurse to patient ratios would be the biggest thing.
Be an advocate for your well-being, and knowing that nursing is a tough field, that if you want to do it in the long haul, you have to really pace yourself. It's a marathon, it's not a sprint. Really, I think if we listen to nurses at the bedside and physicians at the bedside and actually heed their calling and inform choices based on what they're saying, we're going to be better off.
Seeing solutions for themselves and medicine. But statistics show nearly half of all doctors and nurses will leave the field altogether. Next Tuesday, Finding Answers. We go inside one of the busiest trauma centers in Chicago, from COVID to gunshot wounds to accident victims. Leaders are working to help patients, but more importantly, treat medicine as a whole.